name's Megan. I'm going to be your nurse today. Okay, I'm going to be doing an abdominal assessment on you. It's going to take around 15 to 20 minutes. Is that all right?
Yep.
Okay, can you give me your full name and date of birth, please?
Abby Burrow, April 28th, 2001.
Okay. All right, so first I'm going to ask you a few questions. What are your alcohol use habits?
I don't drink alcohol.
Okay. Are there any types of food that bother your GI system?
Nope.
No? Okay. What level of exercise do you get?
Moderate.
Yeah, okay. Do you notice any changes like in your GI when you're really stressed?
Nope.
No. Do you have any GI disorders that you know of?
Nope.
No, okay. Have you ever had any procedures or surgeries in your abdomen area?
Nope.
No. Okay. Do you have a family history of GI cancer? Crohn's?
Nope.
IBS?
Nope.
Okay. Do you have any problems swallowing?
Nope.
No. How is your appetite?
Pretty good.
Yeah. And then how are your bowel habits? Like, is it regular?
Yes. Yes.
Okay. Now, I'm just gonna drape this over your legs just to give you some more privacy. And I'm gonna lay you down in the supine position, okay?
Okay.
So, what I'm gonna be doing is I'm going to first inspect your abdomen, and then I am going to listen to it with my stethoscope. And then I'm going to palpate, so I'm just gonna feel around and make sure everything's okay. Okay? Do you have any pain in your abdomen?
Nope.
No? Sit down. Okay. And then I'm just gonna pull this up, and then I'm just gonna pull this up just a little bit, okay? Okay. Alright. You can just lay your hands by your side. So I'm just gonna observe first, just by inspecting the contour of your abdomen is flat. It looks symmetrical bilaterally. Your umbilical cord is midline. It is inverted. There's no signs of hernia or inflammation. The condition of your skin is good. It looks smooth. There's no color or discoloration. I do notice a few moles and nodules and stuff, but they look fine. They're not asymmetrical or anything. I don't notice any scarring or lesions, sorry. Yeah, just from inspection, it looks good. And now I'm gonna look and see if I see any pulsations. I don't see any. Okay, and now I'm going to auscultate. So I'm just gonna take a listen.
Okay.
My stethoscope might be a little cold. Okay. Just gonna clean it here real quick. Oops. Okay. All right. Okay. I'm gonna start with your right upper quadrant and then make my way around, okay?
Okay.
did hear sounds in all 4 quadrants. They weren't very frequent, but they weren't not frequent enough. Okay, and in the occasion that I didn't hear any, I would also tape for a full minute to make sure. But yeah, okay. So now I'm going to listen to your arteries. So I'm first going to listen to your aortic artery, which is up here, and then your renal arteries, which are just right beside it,
Okay.
and then your iliac, which are down here. Okay. And I'm first going to listen. Sorry, I'm first going to listen with my diaphragm to make sure that there is a pulse, and then I'm going to listen with my bell to assess for breathing.
Okay.
Okay, so I did hear your pulse with all of those. So I heard it in your aorta, both of your renal arteries, and both of your iliac. And now I'm going to assess for breathing. Okay. Did not hear any breathing anywhere, so that's good. Now I'm going to percuss your abdomen, which just means I'm just gonna go like this and just give you a little tap and see what I hear.
Okay.
I would like to reference that I would hear tympany over hollow organs and dullness over solid organs.
Okay.
But first, I'll have you sit up, please. I'll just help you here, just so I can percuss your kidneys. And I'll have you dangle your feet, just so it's just a little bit easier.
You on this side?
This side's good. Yep. Okay. Okay. So, just for privacy purposes, I'll just keep your shirt down if that's
Okay.
all right. I'm gonna move around to this back side. Okay, I'm just gonna move your hair. Okay. All right. So to percuss the kidneys, I will put my hand flat and use my fist. Okay. Now this way. No, I'm gonna do it this way actually. Okay. Okay. Alright, so didn't hear anything abnormal. I'll be lay back down, please. Put this back on you so I can percuss. There we go. Just lift this up for you. Sorry. Okay. Alright. There you go. Put your arms down. Okay. And now I'm going to percuss your liver. So I'm going to first start up here using these 2 fingers. Okay. Alright, so I hear dullness up here, and I hear tympany down here. So I do believe that your liver is in the right place. Okay. See? Now I'm gonna mark the areas where I hear the dullness and measure to where I hear tympany. Okay, so I hear dullness here. So I first heard it up here, and then I'm just gonna do it again just to double check. So okay, so I heard it to around here. And I have a measuring tool. I'm gonna measure it in centimeters. Sorry, I'm just gonna do it. Maybe I'll do it this way. Okay, around 6.8 centimeters between. So that's good. Okay, and now I am going to palpate your abdomen just to make sure there's no tenderness or anything, or distension. Okay, I'm gonna start here. Any tenderness there? Nope. No. Okay. Over here? Nope. No. And here? Nope. There? Nope. Okay, so I didn't notice her to be defensive or anything, or guarded, sorry, I mean guarded. I didn't notice any distension or rigidity of the abdomen. And now I'm not going to perform deep palpation on my partner. I'm just gonna go ahead and close that for you. And I'll sit you up because now I'm just going to explain deep palpation.
Okay.
So first, to palpate the liver, you would go under the rib in the right upper quadrant. You would place a hand behind, place your hand here, ask your patient to take a deep breath, and then push it in and see if you can feel it. For the spleen, it is very similar to the liver. You can roll the patient to make it easier. You would use non-dominant hand again to displace underneath till you're on this side, sorry, on the left upper quadrant. You would ask your patient to take a deep breath in and then push and palpate. You should not be able to feel the spleen, and if you do, then that indicates that there can be an infection or something. So with the kidneys, I would use the duckbill approach, and you should only be able to feel the right kidney. And then for the aorta, you pinch on either side of the umbilicus and then measure it. And if it is greater than 4 centimeters, that could indicate an aneurysm. And that concludes our abdominal assessment. I think you're alive and well, so that's it.